Hey, I'm Dr. Ruth Roberts, and I am really delighted because today with me is Carolyn Grenier, who is a certified holistic pet health coach. And um, she has gotten into this from a really bad experience with her own dog that I will let her explain to you in a few moments. But Carolyn's an animal lover. She's volunteered with many different pet rescues over the years. And about 7 years ago, she began transitioning to a more holistic and alternative approaches for herself as well as her dog, Nigel. She is passionate about empowering other pet parents to take a proactive approach to their furry friends' health and well-being. She believes that prevention is the easiest and best way to go, and that you can't really fix a problem until you address the root cause underlying, which is totally overlooked in conventional medicine because we're accustomed to just solving what's in front of us instead of asking why. Why is this a problem? So her goal is to educate other pet parents about different natural holistic methods so they can make informed decisions to promote their pet's best overall health and happiness. So Caroline, welcome. So glad to have you here
Thank
today.
you. Thank you, Dr. Ruth. I'm glad to be here and tell my story, my two stories. So
Yeah, exactly. And it's really interesting. You have another story to tell about Nigel as well, but let's start with the whole TPLO thing. So what is that? We love
okay.
anagrams isn't the right word, but anyway, abbreviations and jargon in
Yeah,
veterinary medicine. So
long
let's start
words.
there.
I have some long abbreviations for you today, but yeah, the TPLO is the surgery that was done when there's a cranial cruciate ligament tear. So it stands for TPLO, tibial plateau leveling osteotomy. So it's probably the most common type of cruciate surgery that's used, especially for larger dogs, more active dogs. So Nigel is a very active dog, and so that was what was proposed to me when Nigel started limping, and I took him to the vet, and they did an X-ray. Noticed there was a tear, so then they sent me to the surgeon, and he explained to me all the options, which the TPLO, the TTA, the tight rope, and then there's the other one that's like with the suture. I forget the name. It's a lateral suture or something like that.
Right.
So I had to make a decision on doing a surgery for Nigel, but the TPLO was recommended, and it was kind of pressured, on me a little bit, like, you have to hurry up, and, because your dog's going to start getting arthritis. So, and a long time ago, I had a dog that was suffering from arthritis. So I felt, I said, I do not want this to happen for Nigel. So I was, I made a quick decision on doing the surgery. So, anyway, one thing I learned from this, I'm going to say what I learned is that, never, if it's not a life or death situation, do not rush a decision. Sit down, look at all your options, surgery, non-surgical, like look at everything, study, go research, talk to people, never make a decision that is rushed unless it's like, like a life or death situation. So take your time, speak to different vets, get different opinions. But anyway, so we did the surgery, and this type of surgery usually takes maybe an hour 15, an hour 30 minutes. A couple hours later, they had not called me yet. I was like, what's going on? They're not calling me. So 4.5 hours later, I got a call that Nigel was out of surgery. So they're like, he's doing fine, but the surgeon said, unfortunately, as we were doing the surgery, we broke the drill bit into his bone, and we tried to remove it, but it was too delicate to remove it. So the drill bit remained in his bone. So, Nigel was in a surgery a prolonged time, and I'm sure the longer the body's open, the higher the risk of infection. So I picked him up, the next day. We went on, did everything that the surgeon, everything we were supposed to do. And then, a couple of weeks later, we started physical therapy. A couple of weeks later, I noticed some pus coming out of the incision. So I was like, okay, this is not good. So we went back, and, there was an infection. They sent everything out, and the infection came back as MRSP, which is, so it stands for
So,
methicillin-resistant Staphylococcus pseudo-intermedius. If I'm saying it right, that's a long.
you did it, boy.
Yeah, so that was not great. And so
I'm going to pause you for a second. So that's like MRSA, which is like the flesh-eating staph, right? So
right.
that's not good.
Yeah, that is not good. So then they cultured, and the antibiotic that was used was chloramphenicol.
Whew.
Yes. So just to let people know, chloramphenicol is, he was on it for 5 weeks, and it's an antibiotic that I was told, do not touch the pill with your hands, as it could affect your bone marrow. So I had to put gloves to touch the antibiotic and give this antibiotic to Nigel. So for 5 weeks, it was on that. So, that was quite stressful, and he was not getting better, and was a lot of atrophy, and so just to eventually, I was like, what's going on? My dog is not getting, is not coming back to normal. He's still limping, like 2 months later. So ended up going to a lot of different vets for different opinion, and then I ended up in the office of a surgeon that says, once there is an infection and an implant, the bacteria creates biofilms that hides within the implant, and no matter if you give antibiotic, it's might never go away. So the only way to do that, to get rid of that, is to remove the implant. So that's like where I was, faced with a decision of, having to do another surgery to remove the implant. So technically you have to wait, bones take about 12 weeks to heal. So the surgery, we had to wait for the bones to be strong enough before, removing the implant. But then Nigel was scheduled for an implant removal surgery, and that went well. And the very next day, like when I picked him up, like I could see like he was putting, the full weight on the leg. And so I'm like, oh, I think I did the right thing, right? So, and then they sent out a piece of the bone for analysis, and then it came back with osteomyelitis. So then again, more antibiotics and everything. So anyway, bottom line is, there's a lot of risks with surgeries, and something that I learned also from that is the type of implant that is used is super important, because when the surgeon, called me back, he said that the type of implant that was used for Nigel's surgery is an old style of implant, and it's associated with osteosarcoma. So that was the type of implant that the first surgeon had put in him. And, I have the implant here, so I can show people what an implant looks like. I don't know if you can see.
Yeah, there you are.
Yeah, so that's what Nigel had. Can you see it well?
Yeah.
So that's what Nigel had inside of him that was removed. So we had pretty much everything: a broken drill bit, infection, osteomyelitis. So it was not a great experience. It was a lengthy experience, a more costly experience, and poor Nigel, more stressful experience.
Yeah.
So, it's important for people that are going to consider surgery to, be prepared with, the right questions to ask. And I think, I never knew that until now, that you have to ask what kind of implant, and ask them what brand, what make, who makes the implant, and research on the type of implant because obviously it can make a difference.
Yeah, that is crazy. So I want to pause for just a moment and break down because I mean, you're rattling off these medical
Yeah.
terms extremely well, but for a lot of folks, they may not understand what all of that means. So let's start back with what happened. So he ruptured a cranial cruciate ligament. And for those of you that don't know, if this is the upper part is the femur, the long bone or the upper part of the leg, and the bottom part is the tibia, there's a ligament, or the lower part of the leg, there's a ligament that runs from the tibia to the femur to help stabilize it. And it runs from cranial to caudal. And what happens is that ligament breaks, that knee becomes unstabilized. And this is why it's such a big problem, because it's obviously painful. It makes it so that the dog cannot walk comfortably, and their mobility is really uh, limited. And it's very astonishing. So it sounds like the drill bit broke. They were trying to dig it out unsuccessfully. The surgery went long. And then, because of this long exposure to the open air, then the surgical site got infected. And, for chloramphenicol is an antibiotic that I've had to use in special cases, but it was withdrawn from the human market in the mid to late 50s because human physicians were giving it to their children for colds and giving it to them frequently and in high doses, and causing bone marrow suppression or aplastic anemia, which is why you had to wear the gloves. It is not a fun antibiotic to take, and it is used in circumstances like this where you have an incredibly resistant bacteria, but it is hard on the body for sure. And then, unfortunately, what he developed, the osteomyelitis, the inflammation of the bone, you can see that on an X-ray, and it can actually look like osteosarcoma when it's really profound. So Nigel had the perfect storm, but Carolyn, if you had not kept asking questions and gotten to that other veterinarian that told you the correct thing, which is remove the thing that's creating the infection and inflammation, who knows where Nigel would be today? I think you'd still
Yeah.
be dealing with it, or they would have told you, oh, I think you have to amputate the knee the leg, because we can't get the infection under control. That
Yeah.
is just horrifying.
Yeah, that is horrifying. So, I want people to know that, when they go and consider this type of surgery, that they have to, uh, take all of these risks into consideration. Like, I think the percentage of a drill bit is maybe like less than 3%. I mean, I don't think it happens very often, but, it
It
happens,
sucks when it
and
does.
it sucks when it does. And um, you have to, make sure the vet that you go, make sure you use a surgeon, like not just a regular vet, to do this type of surgery. And make sure you find out what their risk of complication is. I mean, what their rate of complication and their rate of infection is in their clinic, and the particular surgeon himself, ask him, what's your rate of complication and your, rate of infection. And make sure you prepare, and you talk to different surgeons. Just don't go with the first one. Get different opinions, and ask, for all the risks associated. And sometimes I think there's better ways than a surgery. um, I think we both agree on that. So
Yes.
importantly, you have to figure out if it's a partial or complete tear. You might choose a different option. There's a lot of things to take into consideration before doing how you're gonna deal with this cruciate tear. You have to look at the age of your dog, the activity level, sometimes if it's an older dog, surgery gets more risky. You have to make sure that you know that there's other options that you might choose before going to surgery. So
Right on.
and as they will tell you, most dogs that will tear a knee will tear the second one, and they told me that, and about 8 months later, yes, that happened. So at that time, with my experience, I'm sure you knew that I definitely was not going to do surgery on the second knee. So that's when I said, okay, what do I do now? This happened. What do I do now? I've used acupuncture on myself, for a long time with, great success. So I said, you know what, I'm going to find an acupuncturist for Nigel. I found a great acupuncturist that comes over, to my house. So we started like doing acupuncture therapy. We started including herbal supplements, glucosamine. Obviously, I was keeping him rested and, shorter walks. I was, making sure he was not, because Nigel is an active dog, is part husky. So, he wants to run, he wants to do things, but, I had to keep him contained. So we were doing good with acupuncture, but then every time I would let him play a little bit, every 3 months or so, like it would regress a little bit. So, and I didn't want to keep him from doing the activities that he likes. So with the acupuncturist, we decided to do a custom-made brace. So a company called OrthoPets, they make a custom brace. You go to a vet. The company's located in Colorado, but they have a list of vets everywhere that they work with. So you just go to one of those vets. They'll make a mold of your dog's leg, and then they send out the brace. And I'm going to show the brace here. I have the Nigel's brace.
Yeah. I used to do that in my brick and mortar practice too. And they're great because it lets active dogs stay relatively active.
Yeah. And it's very easy it's 3 Velcros, so it's very easy to put on. And, he could still swim because Nigel likes to swim. He could still swim with that. And he could still do more activities. So he did wear the brace. I was very cautious. I went longer than planned, but about 10 months with, regular acupuncture and supplementation, omega-3s, glucosamine. So, but he was not wearing the brace inside the home. So it was just when we were going outside, and towards the end, I was just wearing the brace when I would take him to the park. I didn't wear on walks anymore. So as it got better, the brace started to be used a little bit less often. So this was, and this has been several years already now, and and Nigel's knee is fine, and it's been a much easier experience for him, for me, and so we continuously we're still doing preventative acupuncture, just to keep things in place, in check. But so yeah, that was a much better choice and a better outcome.
Yeah,
A
no
different
kidding.
choice.
That's
Yeah.
astonishing, but actually not uncommon, sadly. So it's very interesting that the majority of dogs that had cruciate ruptures that came into my practice, we could get them a brace, do cold laser or acupuncture or both, and then work on controlling inflammation, giving things like Adequan actually to help rebuild it, and then Chinese herbal formulas to help rebuild the ligament. But it's a slow process. So, I think we were chatting a little bit earlier on the human side. What they found out is that the outcome for somebody doing physical therapy, if they have a cranial cruciate rupture that's not complete, the outcome of doing physical therapy versus the surgeon going in and cleaning up the knee is exactly the same 6 months later. And I don't think there's been any additional studies, but probably 12 to 15 years ago, there was a study at the University of Minnesota Veterinary School, and they looked at force plate analysis, meaning the dog was standing on a plate, and they're looking to see if there's equal weight distribution amongst all 4 feet. And so the thing that shocked the surgeons was that the 2 control groups were dogs that got this TPLO surgery, which requires 3 cuts into the bone and then this plate to kind of hold things back together, versus 5 or 6 simple at-home rehab exercises. 6 months post-surgery, the force plate analysis for the TPLO surgery dogs improved from 60% to 85%. And then for the dogs that had no surgery but did at-home rehab therapy, their force plate analysis improved from 60% to start with to like 75%. And the surgeons were absolutely shocked, because obviously the surgery itself is a much more invasive procedure without markedly better improvement. So it's just terrible. So it really is so frustrating.
And risky, and very risky. So, there's like a lot of different risks with the surgery, the anesthesia, all the infections. I mean, I think there's a rate of infection of usually about 10%, I think, which is, to me, seems high.
That's significant.
Yeah.
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 Agreed.
So, and like I said earlier, once you have an infection with an implant, sometimes it can become chronic, and you don't want to have your pet on antibiotic, constantly. So
yeah,
it's
that's
better. Yeah.
so,
It's better to
and
look at all the other options. I would say, save surgery for last, try before. And if that really doesn't work, I mean, if it's, the last case scenario, just use the surgery for last, but at least try. And there's things that you were talking about, physical therapy, things that you can do to help prevent your animal, by physical therapy. You got to keep them at a good weight. Obesity is not good. It puts more pressure on the joints. Start them on good supplementation, like reduce their inflammation, omega-3 supplementation, glucosamine, green lip mussels. You can do the PEMF, which is good. It helps, healing. So because it's hard to know, because the ligament starts with little micro tears and then becomes partial, and then it can become a complete tear. So you want to get on it before things start happening. Especially Nigel was fixed at 2 months. So I think we know that there's a lot of studies that prove that this type of injury happens a lot with dogs that are fixed at a very young age. So if your dog was fixed at a young age, I would say, be proactive and, start putting all the chances on your side with physical therapy, good supplementation.
Right. So when you were talking to the surgeon to start with, how much time did you expect it would take Nigel to recover from the surgery, without all the crazy stuff that happened in the
Right.
meantime?
The normal time was 3 months, and that's pretty much, I think, all of the different types of cruciate surgeries. They all about the same amount of 12 weeks, more or less. So that's what, I was thinking would happen. But from the time that he tore his ligament until the second surgery and the recovery from the second surgery, it was probably like a 9 month situation, between,
Process.
yeah, because we did physical therapy after the first surgery, but he was not like, his muscles were so atrophied. So the therapist said, it's not normal that he's not putting weight on his legs. So, but at the time, it took a little while before we figured out that he needed to remove the implant, because I went to different vets, different opinions, until I landed on this one. And for some reason, when he told me that, it all made sense. I said, yeah. I said, that can make sense what he's telling me. So yeah. So it was like a good 9 months, even, before it could
Wow.
get back to normal.
And then with the using the brace and acupuncture and more holistic methods, you had basically a 6-month recovery process?
Yes. Yeah. And
And how long before he got comfortable with using the brace and the sort of the what we
oh,
would call
it,
conservative management?
it was actually, he was pretty quick. I was surprised that he was pretty quick, like a couple of days, and he was pretty comfortable. The only thing that when Nigel's a male, so when he, goes to the bathroom, he lifts his leg. So sometimes he kind of was losing a little balance, but I kind of noticed that. So I would stay close to him and make sure, he doesn't lose too much balance. I think after a little while, he figured it out that when he lifted that leg, it was a little heavier than, and so he figured it out. But in the beginning, I would like stay close to him and, put my hand just in case, so he would not, like,
So he didn't
injure his
topple
hips.
over.
Yeah.
Right on. Yeah, that's the tough part, getting them used to that, and that's where things like actually help them up harnesses can be really useful, for those of you that may be dealing with this. So you don't have to learn it all from scratch like Caroline did.
Right.
That could be a really, really, really tough. Um,
Yeah. But the person that, usually the vets that will do the mold, they will call you back when they get the brace. They will show you everything. They will make a little video, so that, because the first couple of times you're like, oh, how do I put this thing on? It takes you a couple of times to figure it out. So they'll make a little video for you how to use it, and they'll explain to you, very well how to manage with the brace. And
right on. We got a couple of other questions. So Chris is asking where to get information on at-home physical therapy. So Chris, if you've got practice in your area that does physical rehabilitation, if you can do it, I would go there before you do any surgery and talk to them about getting some support. If you can't, then there are many people that have described some basic conditioning exercises, and that would be a great place to start for physical therapy. Did you do any of these types of exercises for Nigel at home, Caroline?
yes, I did. Yes. So actually, after both surgery, he did physical therapy in a physical therapy center with the underwater treadmill and all these things. Although after the first surgery, it was all worthless because there was the issue going on. So, it was all worthless. But after the second surgery, yes, it did. And, as I was taking him there, I learned some exercises that I could do with them at home. So I did do that as well. I still do, continue to try to make him do certain exercises to, keep strength in those legs. So there's a lot of things you can go on YouTube and, research. Like there's easy things to do, like walking backwards, like sitting, standing. It's kind of like a squat for us, like sit, stand, sideways walking, stepping up on the couch, the first legs up on the couch and the back legs, and then you, with a treat, you make him move a little bit, so there's movement in the legs. So there's a lot of different things you can Google, go on YouTube and research. But I think that's something important. You want to keep your dog's muscles and everything strong so that the joints are more protected.
Right on. And Audrey's asking about using braces for luxating patella. And Audrey, I would say yes, because your guys are a little older. So, and generally it's a medial luxating patella, which means that the kneecap goes to the inside of the leg. So, if they're past that age of, and actually it's weird, many surgeons actually will not do surgery on these any longer. But I think for older dogs, it really does help stabilize the knee and get it more comfortable for long walks. So that's an option. And Cassie's asking about how to find a good vet. Yeah, and it's tough, right? Because your options are limited. So there's this conversation,
Yeah.
So Cranberry's got a grade 4 medial patellar luxation, meaning that kneecap is completely out of the joint and does not go back in, along with the cruciate tear. So that's where, using a splint or a brace would be super helpful. And then Chris is like, yeah, don't go there, had a horrible thing. And Cassie's like, yeah, that's where the vet said to go. And she's almost 2, which really does make it confusing. So it's tough. It really is tough because sometimes you just have 1 or 2 options. So it's, how do you address that? I mean, you had the option of finding other veterinarians where you live, but what do you
Yeah.
say for folks that have very limited options?
Well, I would, if it's something major, traveling a little bit might be worth it, because my experience shows that, and I don't know this particular, the first surgeon who did the surgery, like, it's just, maybe it was bad luck, but that happened to us. But, it's important because sometimes you might go to a surgeon that will charge a little bit more, but their clinic is a lot cleaner. A lot of you will see it's a little bit seems better, and that might be worth paying the extra price, because I ended up in a situation where it was way more costly. So sometimes it might be worth traveling an hour, 2 hours away from home to find a better vet that's you feel more comfortable with. But I live in a place where we have a lot in Miami. We have quite a lot of options, so it's easier for me. But if you live in I would consider searching a little bit outside of your zone and see if you can talk to people. There's a lot of, now with Facebook, there's a lot of good Facebook groups for every type of dog issues. So, go on there, post, ask people. You might find somebody that will, close to you, that will say, oh, I went there, I had a good experience. So.
Right on. And I think that's what's really helpful, is that, you can get, hey, how was it at University of Missouri? And so Chris is saying, no, it's terrible. And, so go look somewhere else. And this is the thing, is that you're not alone. And it's really, really tough to do it alone anymore. So using Facebook groups, I think, are really, really helpful. We've got a Facebook group for the coaches to help support you. If you're not familiar with that, I'm going to drop the link to it. But this is where our coaches go every day to help support people. We're crazy. It's over 50,000 people now. We also have a more
In our
private
group?
group circle. Yeah, it's crazy.
Wow.
We hit the 50,000 milestone this week, which is just amazing.
Oh, that's
So
great.
so that's the thing, is that what Caroline is saying is absolute right. You really need to take a deep breath. Obviously, if your dog is bleeding out, or, something life-threatening is going on, you have to make a decision in that moment. But for something like this, you do have time. And that's where going with a conservative approach um, is not a bad idea, because if you get a brace made, that gets your dog comfortable and gives him the opportunity, or her the opportunity, to start healing. And it may be that in that period of time where you're making a decision, let's say, a month, you see significant improvement. And then maybe it's not such a bad idea to continue with conservative management. So
Right.
the
Yeah,
other,
definitely
yeah,
leave the hardest, most risky for last, like try, whatever is easier on your dog and on you, less risky for him before going to the big risky situation. So
right
because
on.
and probably another thing that I want to suggest, that I haven't done it on Nigel, but I've done it on myself when I had some knee issues. Also, I did PRP, platelet
Hmm.
rich plasma. So for those of you, I don't know if you want to explain what it is, or if you want me to explain, or
Sure, and that was something I did too for dogs with cruciate tear. So platelet-rich plasma, you take a fairly large blood sample from the person or the dog, and you process it so that it produces a solution that is rich in platelets, obviously, as it says, but also things that support healing of of the joint, of the bone, of whatever you're applying it to. And so it's interesting, you can inject it into the joint. My colleague, Dr. Joyce Girardi at Synergy Vet, was actually using a technique of platelet-rich plasma plus amniotic derived stem cell factors, and injecting that into acupoints, which she did for Hio. And I think, in her research paper, she found that it was more effective than actually injecting into the joint itself, which is very cool, because it takes the risk of contamination almost completely away. So there are a myriad of options out there. Um,
yeah. I have had a great experience on my knee for that. The first time I did this, I was really amazed. I mean, like 3 days after, like I felt no more pain and I was doing great. And just the same day of, I felt, a little, because it creates inflammation. It brings, a cytokine storm to the area. So it was a little, painful the same day, but it got less painful the day after. And then 3 days later, I'm like, wow, I'm like, this is great. So I would
you had a really
definitely,
amazing reaction. Yeah,
yeah, I would definitely consider that, for a dog that has a partial tear, that
right
instead
on.
of other things.
The other thing that I think we ought to circle back to is, um, we veterinarians always say, well, if your dog's ruptured one cruciate, he'll probably rupture, or she will, or he or she will probably rupture the other. And the reason is that it is a very specific type of collagen in the cruciate ligament. And what happens is, once one is torn, then the immune system begins to react to it. So if there are any micro tears, like Caroline was talking about, the immune system begins to attack the other cruciate ligament and make something that what might have been a small problem a big problem. So if you know that, then, and this is part of what we teach and train the coaches to do, and Chris, I'll answer your question in more detail in a moment. But knowing that, then how would you address supporting a pet to prevent that second tear from happening, Carolyn?
Yes, definitely. So, the immune system is very important. So, I would remove anything in the pet's diet that can create, his immune system to suffer and get inflammation. So first thing, I think I would start with the diet. We talk about it a lot, and at that time, Nigel was on kibbles. He's not anymore, but he was on kibbles. So I would definitely start with that because kibbles are extremely, extremely inflammation causing. So I would go with a fresh food, homemade, fresh food diet. You're definitely gonna, first of all, you're gonna get the proper nutrients which the body needs to be strong in every way, for the ligaments to be strong, for the immune system to be strong. So you want to give your dog the proper nutrients, and all these extra things they put in kibbles, you want to take that out of your dog's system. Anything that over vaccination is another thing that can attack the and lower the immune system. So consider titers instead of vaccinating too much. And unfortunately, we tend to give our pets too many pesticides. There's pesticides outside, there's pesticides in those flea and things that we give them. Those are highly toxic and will definitely do harm to the immune system. So I would consider going on natural, holistic ways for those things, and remove as much of the toxic things around, your pet and your house. Try to keep it clean so your dog's body doesn't constantly have to fight things, and so that it pushes toxics out all the time. So remove those so that your dog's body does its job and stays strong, and then you can definitely help prevent things like this, or at least minimize the chance.
And that's exactly it. And so, there's a myriad of options: omega-3 fatty acids, joint supplements, pulsed
CBD is probably
electromagnetic.
good.
Yeah, CBD is awesome. Pulsed electromagnetic field therapy. So, and actually, Tammy, you're asking about your kitty that has a broken tibia and fibula. So all of the things that we just mentioned, you can do for your kitty as well. Pulsed electromagnetic field therapy is amazing. Actually, that's how it kind of got its start, was NASA was using it to research supporting astronauts, but also there's a boatload of research on healing broken bones. And so poor baby had surgery, so lots of rest. And then support the immune system in the gut, really good healing nutrients. Just keep the inflammation and the pain control under wraps. And then Beth was asking if you had osteoarthritis in your knees or just a tear when you use the PRP. Your own
Personally,
knees. Mm-hmm.
I think it was a tear. Yeah, it was a tear.
Cool.
But yeah,
Yeah.
I mean, I would, I'm so glad I found that, because now it's like every time I have something, this is what I'm going to use. I've used it in my shoulder also, and it did very well as well. So yeah, it was a tear.
Right on. Yeah, I have four bulging cervical discs and 4 bulging lumbar discs. And back in 20, I could walk about half a mile. And then after that, I was just in excruciating pain, and I was accustomed to hiking, 5 or 6 miles every day. So stem cell therapy and PRP therapy got me back to where I'm completely comfortable, both in the cervical discs and the lumbar. So there are a myriad of options. Surgery is not the first option. So keep looking for other stuff. Right on.
Surgery should be the last option. If everything else has not really worked well, then again, for a torn ligament, if it's a complete tear, though, stem cells and those things might not necessarily work, because the ligament is not connected anymore. But if there's the
Yeah.
slightest bit of the ligament connected, then you have a chance, of that regrowing. So,
Right. And that's where doing kind of the old-fashioned first surgical intervention, which is the fishing line that is designed to actually do that, to provide a structure for the fibrosis or scarring of that ligament to occur so it can heal. That may be an option too. Now, Chris, you asked our favorite question, how the coaches are trained or credentialed. And so 2 years ago, I developed a program called the Holistic Pet Health Coach Certification Program, and it is accredited by the American Veterinary Medical Board and RACE Committee for 40 CE hours for veterinarians and veterinary technicians. And so that gives you an idea of the level of difficulty of this course. And essentially it can be a 16-week course, or it can be a 12-month course, depending on the time that you've got to put into it. I would just go a little slower over the year versus the 16-week or 4-month version of it. But basically what I'm doing is teaching people how to use concepts of functional medicine, how to use concepts of traditional Chinese veterinary medicine, and we then go into how to use home cooked diet. My training's in Chinese medicine, so I teach cooked food, although we're adding in some information on raw feeding from Dr. Ian Billinghurst. And we will probably partner with the Feed Real Institute as well to get you a couple of different options there. And then use diet as the first medicine, essentially. From there, we talk about gut healing, gut health, how to use food sensitivity testing, and then rotation elimination diet to help heal the gut, heal the immune system, and then discuss each of the different organ systems, and wind up with the really bad stuff in terms of understanding how to support dogs and cats with both cancer and autoimmune disease. So that's how they are trained at every step of every module. The coaches have to submit written and most often video homework so that we know that they can understand the concepts and relay those concepts to the pet parent. And then the final examination is two full consultations on video with a pet parent. And you've got Carolyn in here, you've got Beth Rinciar, is one of our other coaches, Audrey Moyna, Jen Collins. So these are folks that have gone through the program. And Carolyn obviously has as well. So
definitely a lot of information that I'm glad I learned, because first of all, I'm happy that I can help my own pet better. And second of all, I'm always, happy that, we're here to help every other pet, live their best life and feel comfortable. And, there's so many things that most people don't know, that if they knew, they would say, hey, that sounds much better, to do that than versus what we're doing now. So, the amount of things that we learn from you is great. So I definitely recommend doing that.
Well, thank you. And so, if you're struggling with where to even get started on some health issue, like how do I go through and figure out what to do for my dog that's got a cruciate rupture? This is where you can get in contact with Carolyn. We have a web page on my site that's dedicated to finding a coach to work with. They are in your corner. They're going to not just look at, okay, what's your current problem, but do a complete health history from back in puppyhood. And you heard Carolyn say today, Nigel got neutered at two months of age, and that probably has something to do with all of the stuff going on. And
Yeah.
she's absolutely right. So that's my point, is that if most of my colleagues, we're there to kind of fix the problem in front of us, and most of us are not trained to look at the entire being and the entire history. And that's where these folks can help you out, help you understand what questions you need to ask your veterinarian about a chronic condition so that you can make really efficient use of whatever appointments you have to have. Make sure that the right lab tests are run, make sure that you get all of your questions answered, and also provide your veterinarian with the information that may change what he or she thinks they ought to do for your pet. So it just makes everything work more efficiently for everybody, for the vet, for you, for your dog or cat especially. And that's the goal, is to help improve what's going on. And
Right. Yeah.
yeah,
And if I may add, like, oftentimes a conventional medicine will look at your labs and say, "Oh, yeah, it's fine," but sometimes we're a little over, and they say, "Oh, it's fine, there's no problem." But if you're going a little over or below somewhere, that means you need to start now to bring that back to normal. But the conventional medicine will wait until the problem is there versus starting before to so we're there to help prevent things from happening, and it's easier to prevent than to wait for the
tend to
problem to be
fix.
there. So
Yeah,
so
exactly. And that is such a frustrating thing.
yes.
And then, yeah, so for those of you that are in the Chicago area, um, we are having two amazing things going on September 8th, uh, 12:30 to 5 p.m. This is the Know Better, Do Better in-person live event where you'll get to listen to expert sessions on canine longevity. Tickets are $30. 100% of the sales are going to support Citizen Canine Rescue, which is a rescue focused on senior dogs. It's going to be a fun event. I'm going to be there speaking on uh, spay neuter syndrome. And if you don't know what that is, you're going to hear a lot more about that in the coming months, not just from me, but others. Amy Renz is going to be speaking on metabolic syndrome. Doggy Dan's going to be talking about enrichment for pets. Dr. Rob Silver will be speaking on medicinal mushrooms. Dr. Odette Suter will be speaking on microbiome. Our own Beth Herenciar is going to be talking about basic emergency uh, things to have prepared for your pet, and also things that you can do to support your pet in an emergency as kind of the on-the-spot first responder. And then Chelsea Kent from Solutions Pet Food and Parsley Pet and the Food Regulation Facts Alliance will be presenting some information on using Parsley Pet tests to optimize and help your pet heal. So it's going to be a lot of fun. We've got some amazing sponsors in Real Mushrooms, Parsley Pet, Goodness Gracious, Pups Pet Club, Standard Process, and then Gussie's Gut and Animal Biome have thrown in some goodies for swag bags for the first 100 people that come. So if you are in the Chicago area, come join us. It's going to be an amazing event. The first half is so much fun because it is the very first meeting of the International Holistic Pet Health Coach Association. We'll be doing some continuing education for the coaches, and it's going to be a fun day at the Morgan Arts Complex. So I just had to put that in there before we forgot, because Audrey's helping me remember. So this has been a lot of fun, Caroline, and you. So if you can get it in, Nigel just had another crazy thing going on, but
Yes.
you kept asking questions and persisting, and I'll let you tell
Yes.
that story too.
Yeah, I'm gonna tell the story quickly. So a couple months ago, as we did a routine ultrasound, they found a mass on Nigel's kidney, like a fairly large mass. So they told me the only way to find out if this mass is cancerous is to remove the kidney. So I said, hold on a minute. I'm not going to remove my dog's kidney just to find out if his mass is cancerous. So with what I know, I started going the very holistic way to try to, manage that mass. from growing, and with IV vitamin C, ozone therapy, and a bunch of, high dose CBD and a bunch of other things. But unfortunately, the mass, we rechecked it in July and it had grown a little bit. So then I was faced with having to, you know, take the risk of the mass growing or removing the kidney. And, since everybody but me thought this mass was cancerous. So, deep down, I always felt it was not. So, I decided not to risk it, and scheduled this surgery that was this past Tuesday. And as they did the CT scan prior to surgery, um, the doctor called me and says, this looks very cystic. The radiologist is not here yet, but so anyway, he was about to go in surgery because the radiologist was not quite there yet. And I said, are you sure? Like, what do you think? And so anyway, we decided to go to surgery because he was not, the radiologist, but he felt it was cystic, but he was not 100% sure. And for some reason, the radiologist showed up. So they called me back as they were gonna take him to surgery, and they said, we're looking at this thing, and it really looks more like of a cystic mass. So a cystic mass. So, and the more we're looking at it, we're leaning more towards a benign mass. So we're in the kidney function, we're looking at it and it's working, properly and doing what it's supposed to do. So we're not sure removing a kidney that's functioning properly is the best thing to do. So they suggested taking the liquid out of the cyst, so draining with ultrasound guidance. So it was all very quick because while they were talking to me, Nigel was under anesthesia. So I had to make like a quick decision. But, I'm like, okay, well, that sounds better than removing a kidney, especially if the kidney's working well, like the cyst was not impairing, the function of the kidney. So we ended up, doing the drainage instead of removing a kidney. So it was a good ending. So
Amazing. And
yeah.
that's the cool thing too, is because you were hesitant. I mean, I think the surgeon was willing to say, well, maybe not, because a lot of times they'd go to
They would go to
exactly
surgery. Yeah. Yeah.
surgery and say, oh, great news, it's a benign cyst. But the
Right.
beautiful thing is that the surgeon's like, okay, I think we'll take some fluid. They'll send it off for analysis, I think you said, and then they'll
Yes.
know, okay, yeah, this is just a cyst. Okay, we'll just watch it on ultrasound.
Right. And then, yeah, I know. And they were both agreeing on it. They were both looking at it. So, and they both said, yeah, the more we look at this. So I'm like, okay, I like that idea better. And so now Nigel has two kidneys and they're functioning properly. And we're gonna, I'm gonna figure out, dig into not, making sure the cyst does not, refill or anything like this. But I'm sure that it's an easier situation than what would have been if I removed the kidney.
Absolutely. So, y'all, this is Carolyn is showing you what happens when you take a deep breath and say, are you sure?
Right.
Or let me think about that. And you get
Right.
enough time to get the right answer to come to you, first of all, and to really have the time to research to make sure that it is the right
The
answer.
proper, right.
Right
Yeah,
on.
so never rush anything, take your time to, get different opinions, like do your own research, talk to people who've experienced that before, like, with their pets. And, everybody, every pet is different. Sometimes it's not always about one thing, like you have multiple options and see what's best for your own pet. But don't put them through something, before researching and knowing what you're doing.
Right on. Well, Caroline, this has been a ball, and so much powerful information out there. So again, if you need help from a holistic pet health coach, you're trying to figure out, what to do for a certain situation. Um, again, obviously I'm a little biased, but this is what coaches are meant to do, both on the human side and on the pet side, is to empower you, the pet parent, to make the best decision possible and be the best advocate. And sometimes, when you're getting information from all around you that, oh no, you need to do the surgery, having somebody that can help you walk through making those choices is absolutely invaluable because it gets overwhelming sometimes when you're doing it yourself.
It does.
So,
It does.
so thank you again for coming on today. We will see you all next week. This is always so much fun for me to introduce you to one of the coaches, bring you some information on a really important topic. So take care.
Thank you.
Check us
Thank you
out
for
on
having me.
Facebook.
Thank you.
Oh, it is my pleasure. And if you're in Chicago, come see us.